Hi, what's going on everyone? So welcome back to USMARI Studio. Next, moving on to step number 5. So, if let's say I want to go to do the chemical peel treatment, so I need to shave my face first before come to do the chemical peel treatment.
Certain things you are not supposed to do before doing chemical peel. One of it is shaving your skin on the same day because you're giving a bit of irritation for the skin already. On the same day, it's not required, or even one day before cannot. At least you should do it maybe 1 week before, or even waxing is not recommended before chemical peel because all that is having contact on the skin and is irritating the skin. So when we do chemical peel, then you're going to have some side effects. So that's why we don't really recommend all day. So certain things you can, even certain medication you're not allowed to take, like retinoids or even some creams that they're using, or even if they use scrub and come and do chemical peel on the same day, it's not recommended. So before doing chemical peel, that's why we do a proper history to know what are the products that they're using, any treatment. Let's say they've done laser, they have to wait for the laser effect to take effect and all that. So it depends on what kind of laser they have done. Some laser you have to wait for 2 weeks, some laser you have to wait for 1 month before you do the chemical peel.
I see.
Yeah, so shaving is no.
This is not recommended, alright? Now, moving on to number 6. Chemical peel can only be done on the facial area.
Which is not true. So chemical peel, you can do it in any part of the body, especially acne, you can have it at the back.
Yeah.
So you can do for your back acne. So those who have discoloration on the elbow, on the knee, on the inner thigh, on the neck area also, they can do chemical peel. So you can do chemical peel on body parts as well.
Moving on to number 7. Is chemical peel expensive?
Okay, compared to many treatments, right? So chemical peel is very, very affordable. It's not very expensive. It's not expensive, I would say. Anyone, even teenagers also can do chemical peel when they have acne and all that. So that's why the price is affordable.
Okay. So, question number 8. Chemical peel use high concentration of acid. Is it true?
Yes, we are using acids. Again, it's all natural based acids. The concentration of it, right, depends whether you're doing a superficial peel or medium peel or a deep peel. So usually we do superficial to medium peel. So the concentration depends. It can be, the higher concentration, it penetrates into the skin a bit more deeper layer. So it is not like for all the peel, the concentration is very high.
So the concentration will depend on the skin problem on this
skin problem and whether they just want to do a superficial peel or medium peel or deep peel, the concentration depends on that.
So for the last question, I don't need to wear sunblock after I undergo chemical peel treatment. Is it true?
It is not true. It is totally wrong. So sunblock is something that you have to use on a daily basis. Even if you're not doing any aesthetic treatment, you have to use at least SPF 30 and above. But once you started doing any aesthetic treatments like medical grade facials or even laser, what SPF 50 and above is a must. Why? Because when you do especially chemical peel, right, so you have done some treatment to the skin, so the skin is going to take some time to heal and to stimulate collagen and all that. So if you expose to the sun, you can get pigmentations coming on, or you can get some sun damages and all that. So after doing treatment, you're not supposed to go direct under the sun. So that's why before doing treatment, history taking is very important, where we're going to ask what kind of work activities that they're doing. If they're someone who loves snorkeling, who loves doing sea sports and things like that, so then they are not suitable to do chemical peel.
I see. So after they're doing the treatment, they cannot be exposed from the sunlight.
So if they do expose to the sun, they have to bring their sunblock and reapply again and again. So sunblock is something that they cannot stop.
Yeah. Some of us might do the treatment and then go expose to the sun, and then we condemn the clinic. Why treatment isn't working?
So that's why a post-care treatment, sunblock is one of the most important things that we always highlight to the patient.
So thank you, doctor, for today's session. So I hope some of us might have a clear understanding about the chemical peel, what do's and don'ts, what the recommendation. And if you have any questions, please let us know, subscribe and like our video, right? Thank you, see you again.